Good evening. Thank you all for joining us for tonight's webinar. We'll be talking about mastering midlife. I'm so excited to be joined by Dr. Robert. Thank you so much for
I'm
coming
excited
tonight.
to be here with you.
And September is Healthy Aging Month. So what better time to talk about ways that we can optimize our health and develop good strategies for healthy aging. And for those of you who have joined us for previous webinars, we've often focused on a problem and a problem specific to midlife. But tonight's webinar is different because we're really focusing on how to promote wellness and thrive and sail through menopause. So I think that as we're talking about different ideas, what I would ask participants at home to do is, use this as a time to take stock in what is working for you and what might not be working. And as always, you have the ability to submit any questions or comments as we're talking. If we were in person, this would be a nice, fun chat with coffee, and I hope that even though this is virtual, we could still make it feel that way. So, what if we start by just talking about what should the basic annual evaluation be for women who are in their 40s and beyond? Meaning, how often does she need to see the doctor, and what things should she expect from that visit?
Yeah, so somewhere around age 40, I think women should get into the habit of coming about once a year to see their physician, even if they don't have specific concerns, just for a routine physical. Things that are important are checking blood pressure regularly, heart rate, going over screenings and appropriate testing that should be occurring around this age and beyond, and getting set up for success as you do head into these changing years. There are certain labs and testing that need to be done regularly, but getting into a habit of a yearly check and going over any issues that may have come up, even subtle things that you think about here and there. Make that list through the year, bring it to your doctor, come in, see what we can talk about, what issues might need to be addressed.
And I could say that as a working woman with kids and other responsibilities, I think it's so easy to just blow off that annual visit, because I feel mostly fine.
Right. But I don't have time. When am I going to do that? Everybody, we put ourselves last often as women, especially working moms or working women, and I think it's important to make that time at least once a year for yourself, because you never know when something subtle means something more too.
Right. And I would add that probably there can be some silent issues, like blood pressure.
Right.
Often that doesn't pop up or you don't become symptomatic until it's too late.
Right. Blood pressure is one that is often silent. In fact, we call it the silent killer sometimes, because you don't feel bad most of the time. Sometimes you don't feel anything. And so recognizing that has become a little bit of an issue now is important to catch it early so it doesn't do its damage while you don't feel anything.
Yeah, and I can't tell you how often patients have come to me at the Midlife Center for a consultation thinking that they felt so crummy because of hormonal issues, and their blood pressure is super high.
Right.
And I said, I bet you're going to feel much better when this is under control. And that's something that most women don't think, oh, I'm going to get high blood pressure. But
right. And other things, on routine screening labs, things like sugar, even that being a little bit elevated can make you feel lousy, fatigued. And so you think, oh, this is just because I'm changing, my hormones are changing, but it really can be other things. So it's important to have that general screening.
And so most patients 40 and above, in general, do you think that they would benefit or can expect to have like a CBC?
I would say a CBC I don't generally check unless there are symptoms that make me think that a CBC would be warranted. Things like more fatigue than usual, or bruising, or my menses are heavy, and that would be a good reason. CBC I don't generally do just routinely, but routinely women should have a lipid panel.
Okay.
So checking cholesterol yearly, and glucose should be checked frequently as we age as well. Now, a lipid panel, if you have an excellent lipid panel and it looks fine, you don't have to have that every year. You could wait 3 years. But if you have some abnormalities in that lipid panel and some risk factors, even family history, it's a good idea to do it yearly, because it does start changing especially as your hormones change. And so being on top of that even before the hormones change is really important, so that as we know it's going to change, you're ahead of the game.
And when I see patients who are coming in with a constellation of symptoms that are common in midlife, when someone says I'm fatigued, there's lots of reasons for that, but the first thing I think is, have they had a CBC lately? Or if we're thinking about starting hormones, I want to make sure that their lipid panel is normal. So right. I think for most women in their midlife, the first thing to do is make sure that annual visit is happening on a regular basis, because a lot of things you can catch early on and might make a big difference.
Right. Preventive care is one of the keys to aging well. Catching things before they become a big issue.
Okay, so does every woman need a thyroid assessment every year?
That's a great question, and there are different societies that recommend different things. Of course, the thyroid specialists say, sure, everyone should have one at age 35, and then the American Endocrinology Society says, well, we probably should screen older women. But the United States Preventative Services Task Force, which looks at all data and tries to make an assessment that's unbiased based on specialty, they don't recommend regular screening unless there are reasons for it. So I kind of do a balance. I try to make sure I have one thyroid in there at some point, but honestly, women come with enough symptoms often that they end up getting one without me just saying, oh, you've never had one, let me do one. Some of the symptoms that make me think a thyroid should be checked, fatigue, high cholesterol. Actually, we should check a thyroid at some point. Anyone with diabetes should have that checked at least once, or elevated glucose. Constipation, change in energy levels. Trying to think of some other things. Just sort of that general, I feel slower, I don't feel as good, I feel less energetic. I will get a thyroid test. And so I end up getting it on many people.
And sometimes my I'm losing hair.
Yes, that's a very common one. My hair is thinner. All of these symptoms are also symptoms that happen
midlife
with midlife and menopause.
Right.
So women end up getting a thyroid test. But yes, that's another one.
Yeah, and I think that's probably going to be a theme throughout tonight, which is midlife and hormone changes can cause a lot of things, but we don't want to overlook the basic stuff, which is like the anemia, the thyroid issues that can creep up.
Right, sugar, cholesterol, those things that we need to keep an eye on.
Do you generally check vitamin levels on patients? I've seen that. I've seen more and more patients come to see me and they ask for vitamin panels.
Right.
It's not something I typically do in my practice unless there's a reason, but how do you feel about that?
I think, again, evidence doesn't show that screening for those regularly is something that we should do. We would have to screen a lot of people to pick up a couple of people who have low vitamin levels, and the people that have those low vitamin levels usually have a symptom that would indicate to me we should go check for that. Also, that fatigue and thing, you check the CBC, and if the CBC is abnormal, then that often prompts you to check certain vitamin levels like B12, folate, maybe iron, depending on what that looks like. So you usually find something else that sends you down that road. As a general rule, I don't randomly check vitamin levels. Sometimes I'll check vitamin D more than other things, but evidence is showing that doing that and treating vitamin D isn't as beneficial as we once thought. So I will check that a little bit more, but as we talked about before, that sometimes insurance companies won't cover that. So
Right.
It's hard to want to be screened for things, but insurance companies really do look at evidence to say, is this something we should be doing? But vitamin D, I will check. It's a lot of people have insufficient levels or deficient levels of vitamin D. Some of that is, we get a lot of vitamin D from the sun, and so some of us are not out in the sun so much. Some of us like to be in the sun, but for example, for me, I wear sunscreen every day, all day, all year. So in my moisturizer, because I don't want that sun damage, and so then I don't get the vitamin D. So,
right.
So I'm a little more liberal about checking vitamin D.
And my feeling is that we like to not treat a lab value. So
Right.
Unless someone is symptomatic and showing signs of being deficient in a certain for a certain vitamin, you don't want to just willy-nilly check a panel and then possibly be treating someone who for them they don't need.
Right. And then are you causing more damage than good if you're treating something that isn't even an
not
issue,
causing a problem.
Or every medicine, even vitamins, can have a side effect. So we want to be careful that we're not over treating.
Agreed.
Sometimes certain vitamins are simply excreted in the urine, and so if you don't need it, you're just going to pass it through. So I had a professor in medical school who said people who take vitamins just have expensive urine.
I've heard that before.
So, which isn't entirely true, but something to think about.
So what vitamins, if any, do you recommend that your 40, 50, 60-year-old take?
So calcium and vitamin D are probably the ones that I generally recommend. And that has more to do with bone health and maintaining good bone health. So up until about age 40-ish or menopause, you really should get about 1,000 milligrams of calcium a day. And then after that, about 1,200 milligrams. And then I always say add the vitamin D in with it, because many of us are a little bit deficient or insufficient in vitamin D, and it helps with the calcium absorption to have that. So that's the one that I generally recommend. Most women, if they're eating a balanced diet, which includes, breads and cereals and even fruits and vegetables, should not have an issue getting most vitamins.
I often will tell patients that are on calcium to split the doses.
Yes.
Do you do that as well?
Yes. Yeah. Split it morning and night. Yeah. Don't try to take 1,000 milligrams at once,
because it's hard to absorb that much at one time.
It is. So if you can do it 3 times a day, that's great. But 3 times a day is hard to do. So morning and night. And remember, you don't have to take all of that in a calcium supplement. If you're getting some calcium in your diet, that's sufficient as well. But that involves milk, yogurt, cheeses, which sometimes we're all trying to avoid some of those things. Ice cream.
Yeah. So it's always ideal, I think, to get it directly from the dietary source, but sometimes there's only so much ice cream one can eat.
This is true. It's a bad problem.
It is a bad problem to have. Okay, so calcium and vitamin D are supplements that are recommended for perimenopause and menopause patients.
Right. If you go to Walmart, you'll see a whole, or Rite Aid or any of those. I often walk through those aisles just to see what's out there. What are my patients seeing? And I will see just, rows and rows of B12. And this B is a very common vitamin. B12 and other B vitamins are hard to absorb through the stomach. You don't absorb as much as you're taking in. So sometimes those are a little bit of a waste at times. And so that's why I say, if you have a problem, take them. But people want to take them for energy. Will it hurt you if you take a lot of those? No, because you will pass those through your urine, but you'll waste some money sometimes on that.
We have two questions that I'm going to get to in a second, but while we're on the topic of supplements, what's your feeling about baby aspirin? I have a lot of patients who ask, should I just go on this for cardiac prevention?
Right. So I think that question has to be answered individually with each patient. As a general rule, I don't recommend baby aspirin as a primary prevention, though especially in women in this transition, it can help reduce cardiovascular events. But then you also have an increased risk of bleeding, GI bleeding especially. Mm-hmm. And so you have to balance that risk and benefit. If you already have a cardiovascular history or you have a strong family history, then I might lean towards it's a good idea to take it. But then it should be a baby aspirin, not more than, those are 81 milligrams, but not more than 100 milligrams. But if there's no other cardiovascular risk factors, if there's no family history, then I would say I would not recommend it as primary prevention for most people.
And one of our guests is asking, what about women that have an autoimmune disease like lupus? Is there any special screening or testing that they would need to do?
Anyone with an autoimmune disease should be screened for thyroid disease as well. So lupus, if you have that, I would certainly recommend thyroid screening and a CBC, a blood count, to see if there's any signs of anemia. Keeping track of kidney issues and diabetes, screening for those. Any other major medical issues that can also have autoimmune things like diabetes, autoimmune base for developing it, diabetes, things like that. But certainly thyroid for anything autoimmune, diabetes, and anemia and kidneys would be standard screening that should be done regularly, if not yearly, but maybe even more frequently than that.
That was a great question, and probably that you'd have the same answer for most autoimmune diseases in general,
yes, not just lupus. Autoimmune in general, absolutely thyroid, because that is often an autoimmune disease as well.
There is a question here about sleep, and I'm going to table that for a second because we are going to talk a little bit about sleep. Okay, so in going down our typical kind of basic, what does each woman need to do to keep herself healthy? We talked about seeing her primary care doctor once a year, having that basic screening, blood pressure checks, exam, some blood work. And then at what point do we need to do some more specific preventive health screening?
Right, good question, because that is something where we start again thinking about ourselves, like, oh right, it's time for me to do a mammogram, and all the things we get to look forward to. So mammogram screening, breast cancer screening should start around age 40, earlier if there's a family history in a first degree relative. And then that should, I generally say yearly. I feel like there's just enough breast cancer around. I don't recommend skipping, though there are some recommendations that you could do that every other year, or wait till age 50. I generally recommend.
We do too. American College of OB/GYN recommends yearly as well.
Right. Other screening at age 45, you should start colon cancer screening. It used to be age 50, that changed a couple of years ago. So age 45, again, sooner if there is a family history or high risk indications. And that can be done by colonoscopy or other stool tests, fecal immunochemical testing, or a Cologuard type testing. But you should have some sort of colon cancer screening starting around age 45. And then depending on that result, it depends on how frequently you need to do that.
So that was, I still think of 50. And so I think that a lot of participants might be surprised that at 45, we need to start screening for colon cancer.
Right. It just changed a couple of years ago. In fact, I was in that range where I was fine, and then all of a sudden I was overdue. So
I think that's why I think 50, because I don't want it to
subconsciously you don't want it right now, right? So right, agreed. That should be at age 45. And then if everything's okay, it might be, you might not have to do it for 10 years. You might have to do it in 3 to 5 years, depending on what is found, but and depending on family history too. By family history, in particular, first degree relatives are, if you have a first degree relative with colon cancer, you should be screened earlier.
Okay.
And more frequently.
Okay. Okay, so we talked about breast cancer screening. We talked about colon cancer screening. Of course, having our annual GYN screening with PAPs that sometimes can be staggered and doesn't necessarily need to be yearly. It just depends on what your PAP history has been. But having a GYN exam annually is recommended. For osteoporosis screening, generally I say unless there's a strong family history, wait until age 65.
Correct. Yeah, I say the same thing. Strong family history, a history of fractures or a hip fracture early, or if you're on steroid therapy, systemic steroid therapy for a prolonged period of time. Other risk factors include that you may want to move that up would be smoking. Smokers are at higher risk for bone loss. Certain ethnicities too. Actually, Caucasian is at higher risk than other African American or Native Americans or even Asian Americans. Thin women, very thin women, Caucasian smokers are at highest risk.
And then maybe at early menopause.
Early menopause, good point.
Also. And then one question that comes up is a concern for the brain fog being indicative of something more significant.
Right.
So we did have a webinar that did specifically address dementia and cognitive decline with aging and how to distinguish it from just typical aging versus a more pathologic disease like Alzheimer's. But in general, at what point do patients need to have any special screening, or at what point do you want to see a patient and possibly refer for further evaluation?
Yeah, that's a good question, because I get a lot of people that say my memory is just not what it used to be. I forget words. I forgot where I put my keys.
I go to the refrigerator and I forgot what I was getting.
and I come back and sit down, and then somehow I remember and I walk back and
start over again.
Right. Or I forgot about this detail or that detail. There is not a general screening that happens at a certain age for dementia or Alzheimer's dementia. But some of the ways that I try to distinguish that from the normal brain fog are you still able to manage your finances? Are you able to calculate a tip when you go to a restaurant? Those are higher executive functioning skills that usually indicate the brain's okay. And if you're forgetting some things, it may be related to the brain fog of menopause, or maybe there's other things going on. Depression actually can cause a lot of, untreated depression will cause memory loss or forgetfulness or, sort of a detachment. So I try to look for other causes, certain vitamin deficiencies. If somebody's feeling that's where I might check something like a B12 level if someone is talking about feeling a little more forgetful. But I look for higher executive functioning skills. If I do have somebody that's worried about memory, there are tests that we can do in the office. Just simple, remember these words. What are these pictures? What are these objects? Count backwards from 100 by sevens for me, or spell this word backwards. There are different things like that we try to test for not just memory, but higher executive functioning.
Someone is asking, is the best way to test your thyroid through a blood test?
It is the best way. It's the first way. 95% of people with thyroid issues, the thyroid stimulating hormone will be abnormal. There are rare cases when other things will be unusual, but usually have much different symptoms or much more severe symptoms. Okay, so.
And then
just one thought on that though, an exam of the thyroid, if there is anything that's palpated, this is another great reason to come into your primary care doctor. If I palpate anything that feels unusual or a lump, then I will get not just a blood test for thyroid, but also an ultrasound to make sure that what is that bump.
Yeah. And something that I think folks at home can do is if you're feeling like you have more mass in your neck, or like swallowing, you feel like there's like a lump in your throat, that could be a sign. Usually it's not, but a reason to see your doc and have it evaluated.
Right.
We didn't talk a lot about vaccinations, and that probably can be an entire webinar in and of itself. Yes. One of the participants is asking about the shingles vaccine.
Yes. Okay. So that's a great question. So the Shingrix vaccine is a 2-part series, and the indication is to start at age 50. There was a previous vaccine called Zostavax that was a 1-shot. You didn't get it until age 60, and it honestly was not as good as the Shingrix vaccine. So the Shingrix vaccine is very good. Even if it doesn't 100% prevent shingles, it is really, really good at preventing the complications of shingles, which the most debilitating one is actually nerve pain from shingles. So you can get people that have, severe neuralgia in their face or their head or wherever. And so Shingrix is excellent at preventing that, so much better than the old shot. So I recommend getting Shingrix at age 50. It's a good shot. It has very few side effects, and it's really good at preventing complications from shingles, even if you got a mild case of shingles.
And do you have to repeat that?
You do that. You do a second shot, 1 shot, and then a second shot, but you do not have to repeat it then. It's good for the rest of your life.
Oh, wow. That's great.
Yeah, it's good. You will likely feel a little under the weather from that shot.
Oh, okay.
So I tell people, plan to have a day that you can be a little down. You can power down the next day. Do it on a Friday or a Saturday, or where you have that day to rest if you're able to have that luxury, and because it does generate a pretty good immune response. You'll feel lousy, but that means it's working. Right. Your immune response is working.
And worth it to prevent
a
bad shingles outbreak and the sequelae.
And then the sequelae. It's really, really good to prevent that sequelae.
Yeah. Okay, so 50 for that.
Yeah, anybody who's had shingles will tell you it's pretty painful. You think, oh, it's a little rash. What's the big deal? But in some people, it is just a little rash and it burns for a couple of days. But other people can have severe complications from it, including if you get it, if it's involving your facial nerve, it can actually involve your eye, and that can be very dangerous. So and you don't know where shingles is going to pop up until it pops up. So if you've had it in an arm or on your back, then you're not going to get it on your face, but it still can be very painful. I would still get it even if you've had shingles before. Just get it.
Okay.
Get the shot. It will prevent any future sequelae.
That's a really good tip, because I think we often think if we've had shingles once, then we're good. We're safe, but
you can get it again, and you can get the sequelae even if you didn't get it too bad the first time.
Okay, that was a great question. Okay, so we have some good questions in queue, and let me start with the question about sleep, because sleep is such a huge symptom that so many patients in their 40s, 50s, and beyond come in complaining about. So I'll let you tackle it. How do you?
Maybe you should. This is a great one, because there are so many reasons people aren't sleeping well, and so I think really getting into why aren't you sleeping? Are you waking up because you're having night sweats and hot flashes? Are you in pain? Do you have pain somewhere? Do you have stress? Do you have anxiety, depression? Are there other things going on? How much alcohol are you drinking? When are you drinking caffeine? Are you drinking caffeine? Are you having a cup of tea before bed, or are you drinking, soda until in the evening that has caffeine? So I think there's so many reasons that sleep can be impaired. So it's really worthwhile to dig deep into why. That being said, I think sleep is one of those things that, as you talk about this all day.
I do. I talk about sleep a lot.
About the sleep, and because if you were, inevitably, I think most people are going to have some issues with sleep.
Yeah, and even if patients don't bring it up, after they tell me all the things that are wrong, I'll ask, how are you sleeping? Because it's such a
very common.
They did, if any of my patients are listening, they've heard me say this. They did a study in midlife women who came in with a laundry list of all the things that were bothering them. And the investigators did one thing only, which is help women sleep. And that made everything else feel better.
Right. I think that's huge. Tackling that sleep will help so many of the other issues. Poor sleep affects mood, affects ability to cope the next day. It affects weight gain. It affects just your energy level the whole next day. All kinds of things. So I think it makes sense. I'm glad to hear about that. But fixing sleep will help a lot.
And so the wonderful person who asked that question is probably thinking, okay, yes, I know, I know it's wrong. How do we fix it?
But how do I fix it?
And I think what Dr. Roberts is saying, and I 1000% agree, is figuring out where the problem lies. I happen to think that for women, it can be a few different things. And it probably starts for us if we've been pregnant before. Like, we're not sleeping well for all the reasons that when you're pregnant, you have trouble sleeping. And then you have a newborn baby. And then it's just for the rest of your life, you just have kind of poor sleep hygiene.
Right. And teenagers they don't help you sleep any better.
No.
Even though they might sleep better, the worries that come with parenting, all that affects sleep. All those things, the work stresses,
the partner snoring.
Right. I was just going to say that. Maybe the person next to you doesn't sleep or sleeps so soundly that you don't.
Right. So I think, like, the way I approach it is trying to figure out what is disrupting your sleep and then tackling that.
Right.
And very often I'll hear patients say, I don't know, I just wake up at 3 a.m. and I don't know why I'm not sleeping, but I have trouble falling asleep, and it happens all the time. And
Right. So again, digging in, why is that sleep disrupted? And then there are natural things, melatonin, I recommend. At times people think they have to take that right before they fall asleep, but really if you take it, your natural melatonin increases as the evening goes on. So if you actually take it a little bit before you go to bed, then it's really, it's where it should be when it's time to fall asleep, not right before you go to bed.
Yeah. That's a good tip. Melatonin, and I also love magnesium as a relaxing.
Right. I've heard a little bit about magnesium. I haven't.
I love magnesium. Magnesium Magic. It's a great book.
Okay, great. Well, and magnesium can help with things too, like leg cramps and restless legs, and that's often. So restless leg, there's another reason why I might get a blood count and find out if people are anemic or their iron levels are low. Those are often, especially in the perimenopause when periods get heavier and blood loss is heavier, then you're anemic and harder to build those stores back up. So I have found sometimes treating iron actually helps restless leg, and then they sleep better.
Yep, that's a great thing to think about.
I was just thinking other thoughts. I think one of the hardest things, I don't know if you have thoughts about this too, is that person who says, I have no trouble falling asleep, I stay asleep, then I wake up in the early morning. Early morning wakening is often a sign of stress and in maybe anxiety or even depression. But and I don't know, do you have other recommendations? Is that where magnesium might help?
Yes, because it does have a relaxing effect. But one of the things that I think happens is if there's any unresolved stressors or anxiety, it's gonna come out one way or another.
Right.
And so if someone doesn't have some built-in stress relievers in their life, like meditation or prayer or just mindless exercise, by mindless I mean I have a dad who says I don't need to exercise, I work hard every day, but like exercise for the sake of exercise.
Right. Exercise is a big one that I push. Any type. It doesn't have to be running a marathon. It doesn't have to be a big class at the gym or something. Just movement in some way. And when I find those people with that early awakening, I ask about stress relievers too. And I often recommend exercise. Lots of reasons to recommend exercise, but one of the reasons is that is your stress relief, and especially for the moms or the working women that are juggling a lot of things, that having that carved out time, this is my time that no one can bother me, or that I can think through everything, or I don't have to think about anything at all. Just having that little bit of time for yourself. I know it's hard sometimes to find that, but even 15 minutes can help. It actually helps improve sleep if you are exercising and moving more.
Right, because you're like wearing your body out.
Right, you're tired.
One of the girls in our office said, I bought a kayak so I could exercise and no one can get me.
Right. That's right. They can't get me. They can't find me. They can't get in touch with me. But I also, from another standpoint, I recommend any type of exercise, because I think then we are good role models to our family about the importance of exercise, the importance of taking care of ourselves. But yeah, meditation is good too. Excellent way.
Life-changing, I think. But it all takes intention, because I preach this stuff all the time, but I find it hard to even get 5 minutes to do these things.
Right. It's true. 5 minutes. You can't even go to the bathroom by yourself. You have littler ones,
but it's and my husband notoriously will say, you practice what you preach.
Right.
But it really can be like not take a lot of effort or a lot of time, but really have significant impacts.
Right. Finding even if you can't do it every day, find a couple of times a week where you get 5 minutes, 10 minutes, 15 minutes to yourself.
Yeah. And then, of course, there are prescription meds for sleep. What I've found is, even with the best intentions, it can be hard to get off of prescription meds. They can be addicting.
They can be. Right. And you sort of, even if they're not addicting, you become reliant on
Reliant, that's a better word.
Yeah, you think that I have to have this to fall asleep. And so I try to avoid, I'm a big fan of the least amount of medicine as possible. So if we can find other ways to do that, or natural ways like magnesium and melatonin, I feel better about that than anything else.
Agreed. And then a plug for behavioral therapy.
Yes.
Dr. Kelsey Steele, who has been on this chat a few times, has famously said, I can fix anything with behavior that you might need medicine for. And that's one of the big ones. And just, I won't do it justice, but what she tries to do is help you realize some of the habits that you get into and some of your reactions to things that happen. Like, I'm awake now, I'm going to be tired tomorrow. It's all bad.
Right. And then you start looking at the clock. Now I only have 2 hours more I can sleep. Oh, now we're down to 90 minutes. Okay.
Yeah.
So, behavioral therapy is wonderful.
Yeah. And we're so fortunate that we have access to wonderful behaviorists here. Okay. We have some really more good questions. One patient is asking about a pellet injection to help with menopause. So the famous pellet injection, I get this question a lot. I think what the participant is asking about is the testosterone pellet injection. And so the idea is that as we get older, we know that when we go through menopause, we stop making significant amounts of estrogen and progesterone, but our ovary also makes testosterone. So in menopause, our testosterone levels tend to decline. They actually start to decline even earlier in our 30s because our adrenal production starts to slow down. And so one potential consequence of that is fatigue and lower libido. And so there are testosterone pellets that are injected or placed under the skin and last for 3 months, and they kind of secrete in a pulsatile fashion testosterone. And I don't administer those injections, and that they're not recommended or endorsed by the American Society for Reproductive Medicine, the North American Menopause Society, or ACOG, because it is a commitment, and potentially you can, over long term, there can be negative consequences to it. So what my personal feeling is that if a woman is having consequences or symptoms from low hormones in general, often the first baseline is addressing symptoms related to low estrogen, and very often that can help remedy some of the symptoms that you might perceive are low testosterone.
Right.
And then sometimes we do use supplemental testosterone as well, but we can do it in a way with gels or patches or creams that you don't have something injected in you that if you don't like,
you're stuck for 3 months. Right. It's the same feeling, right? It's generally not something that we recommend. We look for the other ways to treat issues.
Yeah, I think that there are safer, more well-studied methods of using it. So that's my thought on it.
Yeah, and if I have somebody that I'm wondering about that, I send them to see Dr. Ochalski, and she can address that.
Another participant is asking about dry skin. Is that common in midlife, especially hands and feet? I've tried several brands of lotion, some help. Are there any other specific recommendations to consider?
Do you have a recommendation generally? Or?
Well, first I would validate that you do kind of get dry as we get older. It stinks.
Right.
And then I also sometimes, it's not uncommon that suddenly you're a little more sensitive to topical, like fragrances and other preservatives in those topical lotions.
Right, especially alcohol-based lotions. They are very drying, and anything with perfumes in them usually has something else that can make your skin sensitive. One of the things that's another reason I might check a thyroid level, but again, normally that comes back normal. And if it were to come back normal, I think one thing to think about too is, are we hydrating ourselves as best as we can to help on that side? But I think a lot of the skin changes are related to collagen decrease. There's a lot of information about collagen supplements and what works and doesn't work. And I don't know if you have anything you recommend on that.
I do. So with if someone is experiencing dry skin or hair, brittle nails, or like hair thinning, I do talk to them about collagen. And I think there's lots of collagen supplements out there. I also love bone broth as a good source.
Right. I've done a little bit of research on that. That's one that seems to have what the collagen types that you need. Then, because there's different types. We can go back to medical school days. But right.
Do you have a favorite, or?
I don't really have a favorite. I'm still sort of, as new things come out or I hear about, I get a lot of advertisement. What do you think about this? I try to look each of those up and really understand each one of those. So I don't have a favorite right now.
No, I don't either, except if possible, getting it from a dietary source.
Right.
But it's it could almost be a full-time job just to vet all of these different products, and it's tough. Even when you're in medicine, I find it really challenging.
Right. Yep. It's hard to find good sources of information.
Yeah.
And with social media, there's a lot of bad sources of information, or
Mhm.
maybe not, that don't have the evidence. I always try to look for the evidence behind it,
Yeah.
studies.
Yeah. My favorite example is listening to one in the same day, listening to something saying tomatoes are wonderful, they prevent cancer, and then tomatoes should be avoided, they're very inflammatory, and I was pulling my hair out.
Right, exactly.
So, trying to get to the source, which is time consuming, but gives you the best answer.
Right.
So for the dry skin, what Dr. Roberts and I agree said is make sure that you're hydrated. You can consider a collagen supplement. And then if you're going to use a topical cream, just if you're sensitive, be aware that many lotions may have fragrances or preservatives. And even if you tolerated those things before, sometimes your sensitivity to those things can increase as we get older.
Definitely.
How does sleep affect weight gain? That is a great question. So there definitely is an association with poor sleep and increased weight gain.
Right. And I think we could look, there's probably a lot of physiologic discussions we could have about that, but I think some of it also relates to insulin resistance. But poor weight gain also, poor sleep results in, less exercise, less, eating more things that aren't as good for us, not coping as well, and looking to those comfort things. That's certainly one way, but there is an association between poor sleep and weight gain.
Yeah.
I'm sure I know I've read about studies that look at sleep and weight gain and obesity and recording number of hours of sleep, but I don't, to talk about the exact physiology of it, that's probably a whole nother talk.
But I do think it kind of makes sense that if you're sleeping well and waking up well rested, you're going to be more likely to have energy to exercise and make healthier choices. And then if you're exercising, you're going to wear your body out and probably sleep better. So
it's a vicious cycle that can go both the good way and the bad way.
Yeah. A participant is asking about naps, which is a great question. And there is, some people say naps are good. I actually, a few years ago, a book came out that was dedicated to describing the importance of naps and how everyone should take at least a 15-minute nap in the afternoon. And then some people say, nope, you're better off not taking a nap and powering through so that you have deeper, better sleep in the evening. I don't have a strong opinion about that. I think if taking a nap makes you feel good, then do it.
Right. I feel kind of the same way. I think you can hear about information on both sides, but I think in general, naps need to be just that. They need to be a short, quick, not an hour or two, certainly not longer than 45 minutes. But if you can get a quick, 15-minute shut your eyes and feel refreshed, that's okay. If you try to sleep for a short amount of time and you don't feel refreshed, then naps are not for you. But if you can do that short nap in under 45 minutes, preferably 20 or less, and you feel good, and it gives you energy, and you're still able to sleep well at night, then do it. But if you're finding that the nights that you take a nap, you're not sleeping well, then get rid of the nap. Power through in a different way. I think it's really important to keep a log of those types of things too if you're struggling. Sleep logs and food logs, diet logs. what are you eating and drinking through the day and at different times that might affect sleep or need for naps. Sometimes naps are sugar crashes. You have you eat some junk and then you kind of crash after that. So watching that kind of thing.
I love logs because I think that we can, especially women, can tolerate a lot of symptoms for a long time, and then we'll make a few changes all at once and then not know
what's the thing that helped.
Yeah. So keeping logs is great. Okay. The next question is probably something everyone's been waiting for, which is suggestions about how to stop weight gain in menopause.
Right.
Okay.
The magic pill.
All right. Tell me what it is, because I don't
have it either. I don't have it either. But the things that I can say that can help fight the weight gain, obviously exercise. But I think even it's not, again, I've talked about move, just make sure you're moving, make sure you're doing something, especially as you age. As people age, the people who age the best are those who move. And it doesn't have to be marathons, like I said. It can be walking, it could be dancing, it could be yoga. But one thing that seems to help a lot with holding off some of the weight gain can be adding in some weights and building muscle or maintaining muscle, because muscle helps burn calories better. It's a more efficient calorie burner. Yeah. And so adding in not just walking, but some sort of, add in a little bit of upper body weights or some lower weights, something like that often can help.
That's a good tip. It can be shocking how it feels like suddenly the weight is just suddenly there. And it's unfortunately part of life that as we get older, we are more prone to gain weight and it's more difficult to lose weight. And for men, it seems to come on a little more gradually, like the beer belly develops in their 30s, and it's different for women where it seems like suddenly I have a tire around my waist.
Right.
And I believe that as we are aging, we're gaining, unfortunately, we're gaining weight, but for most of our life, we deposit it more uniformly.
Right.
And then in menopause, it all is preferentially in our midsection.
Right. Right.
And it feels frustrating because you can be doing all the right things. Right. And I see another participant saying, I exercise on a regular basis. I'm eating well. Why is this happening? And I know exactly how you feel because it's unfortunately common.
Right, right. I think just, again, sometimes those logs, making sure that what you're eating, what are you eating, kind of keeping track of that. I think sometimes women tend to go on sort of, let me try this diet or crash diet. And then you get these cycles of up and down. So those are hard. Diets really should be something that can be sustained. I don't generally love the word diet, but changes in what you're eating should be something you can do over a long period of time.
I agree.
People talk about keto diets and this and that. If that's something you can do for 5, 10, 15 years, great. But those are often hard to do.
I couldn't last an hour doing it. I tried.
Right. So again, like it is frustrating because part of it is that lack of estrogen, and so and that's what that central deposit of weight.
It's so like our pants are tighter, and that's what's associated with visceral fat. So we don't, we don't want to just say, oh, it's inevitable,
right?
Do nothing about it. Importantly, if a woman in menopause decides to start hormone therapy, it doesn't significantly change that. It doesn't. It really is a weight neutral strategy.
Right. That hormone therapy can sometimes help some of the other symptoms, but in studies it hasn't shown to really change weight a lot. Again, weight gain would be a reason to check thyroid. Again, just to be sure there's not something else causing it. But it seems like most of the weight is gained right around that menopause time, and then sometimes it comes off again. But right around that change seems to be. Or do you find that with most of your patients?
I do. And I think when you look at studies of women in midlife, it's almost inevitable, and I hate using that word, but for the majority of women, there is a weight gain that happens. It's around 5 pounds, and it's, even when someone doesn't struggle with weight, it very often happens.
Right, and it feels that way. The other thing is the weight is different. It is. So that's where like having more muscle can help sometimes. And one of the reasons why I try to encourage people to do their best as they approach those ages, because we, like you said, it's almost like we know it's going to happen. What can we do to be at our best when we hit that change of life? So,
right. Yeah. So I'm hoping, and I hope I'm not being too depressing. I mean to inspire you, get out there. But I think that like the take home messages are that hormones don't affect your weight gain or your ability to lose weight. They can make you feel better because they help you sleep. They take away hot flashes, and then you'll be more active. But hormones themselves aren't the magic pill.
Right.
Exercise and including weight-bearing exercises.
Yeah, varying the type of exercise that you're doing. So if you've always been a runner, maybe add something different in. It sometimes can help. Might only change a pound or two, but sometimes that pound or two feels a little bit better, or changes where it's distributed.
Diet, having a healthy diet, and I'm not a fan of like the strict kind of restrictive diets that are just not sustainable, right? Because often the rebound weight gain is worse than where you started.
Right.
But something sustainable that makes you feel good too, I think is really important. And I think so. We haven't talked about insulin resistance, and we'll probably be wrapping up shortly after this. But I know this is an important topic for the ladies listening at home. I think as we get older, we are more prone to develop insulin resistance. We're not as sensitive to insulin.
Right.
Any comments about that? Like, should we screen for it?
Yeah, that is one of the things that I do think it's worth screening, where you screen for your cholesterol or lipid panel. You screen for diabetes and glucose. Because if you are showing signs trending towards that, all the more reason where we can start some things that help prevent diabetes, cardiovascular risks, things like that. So getting into metabolic syndrome, which is a combination of insulin resistance, low HDL, which is the good cholesterol, high triglycerides, which comes from lots of different things, dietary fats, sugars, sweets, alcohol. So certainly screening for insulin resistance and elevated glucose is important.
And 2 participants asked specifically about intermittent fasting, and that has been evaluated in the midlife population and shown to be an effective, healthy weight loss strategy. I'll divulge that I intermittent fast all the time, and it feels good for me. But it's not for, as much as I've tried to sell it to other people, it's not everyone's cup of tea.
Right. I think the diet or the plan that works is the one that works for you. And so intermittent fasting works for some, not for others. And I think you try it and see what you think. But there is some evidence that it may help. But I think it's important to be a role model too to the people around you. And we want to be careful, especially if we have teenagers or young women in our life that may have already some issues around their weight. And so being a good role model to and making sure they understand what intermittent fasting is, that it's different than and calorie restriction of young adults. I worry about that a little bit.
That is a really good point. It's become so popular, and so many people are, praising it, and that is a vulnerable time, particularly our teenagers, that we want to be clear about what the intentions and purposes and methods are,
and why that's different, and why it's okay to not follow it completely, or at times follow it.
Right.
But to make sure they understand it's not restricting because I don't want to eat, because I don't want to gain weight, or
right.
that it's actually a fasting plan.
Right. And then someone asked about Ozempic, which is one of the newer weight loss medicines.
Right.
It's an injection. What's your?
So I am recommending that for some people who meet some certain criteria, which is elevated BMI and signs of insulin resistance, but it's often not covered by insurance, and it can be quite expensive. But there is evidence that helps with weight loss. It's something that you have to do forever or for an extended amount of time, so that can be an issue. But there is good evidence coming out that's an option.
Yeah, I've been seeing more and more patients on it, and they have what anecdotally I'm seeing is some good success. So, but the coverage for it is kind of spotty. A lot of patients are paying out of pocket.
Right. And it can be very expensive. And then the question is, what happens when you go off of it? So does that weight come back? And so that's where the question is, do I have to be on this forever? Or so I think there's probably more questions than answers about that right now.
Yeah. I want to put a plug in for our amazing weight management team at WellSpan, which is different than the bariatric program. These are weight loss specialists that really try to optimize and exhaust medical methods, diet strategies, and pharmacologic remedies for weight loss.
Right.
And again, we're so fortunate that in our system we have those specialists. So they're wonderful.
Right. Good resource.
Really good resource. Okay, I know that there are still some questions. I will answer you directly for any of you who I didn't get to your question. Anything else that you would add?
I can't think of anything right now. I think one of the most important things that I tell patients is move. Keep moving. Keep moving. That will help you. It helps with the joint aches, all of the many of the symptoms.
Yeah, keep moving. It's kind of true. If you don't use it, you lose it.
Right.
And I think a final plug would be that there's so many amazing providers like Dr. Robert. And so we're here for you. And so whatever questions, concerns are on your mind, come in and talk to us. We are here for you.
Let us help you.
Yes, please. So we'll say goodnight. I'll let Sue finish up. Thank you all for joining us tonight.